Good evening. It's 8 o'clock. The top headlines tonight. A dip in India cases today below 3.5 lakhs. Deaths also down today, but concerns over testing, which is dropping in major cities. Also from Uttar Pradesh, this story on how funeral pyres are belying of official death data. Amid this, our COVID crisis, Kumbh's final Shahi Snan, numbers are less, but still crowds which are too much for COVID times. First oxygen and now it's Delhi's battle for beds. Patients die on the road outside the new Sardar Patel COVID Hospital Centre. No ICU bed at Apollo Hospital. The family attacks doctors and nurses as patients die on roads. Desperation and anger spills over. The Chief Minister promises 1,200 more beds by the 10th of May. Pandemic on, but a 20,000 crore central vista is priority. Amid a health crisis, this is being made into an essential service. So the work here is continuing even in the lockdown. The opposition says use the money for beds, oxygen and vaccines. After the Prime Minister Modi, President Joe Biden call, massive United States aid begins. The US also will be sending AstraZeneca vaccines to India. Also, French President Macron's Facebook post in Hindi assuring medical help to India. Kerala crosses a new high of over 30,000 cases, goes into emergency mode in Karnataka. Lockdown from 9 p.m. tonight as fresh cases are also at a new high. A day after a rap from the Madras High Court, the Election Commission announced it will ban victory rallies on the 2nd of May. The Election Commission in a statement also says it is the state's responsibility to ensure COVID protocol, not ours. And meanwhile, a Shadi in PPE suits as the groom is COVID positive. COVID craziness, getting married at any cost during the auspicious marriage season. Well, let's begin with the latest figures. What's actually happening on the COVID situation? Well, it's the 6th straight day of over 3 lakh cases, 3.23 lakh fresh cases in India and 2,771 deaths in 24 hours. Now, the cases are nearly 30,000 lower than yesterday. Deaths are also 41 lower than yesterday. But this comes amid some concern over whether India is testing enough. If you look at our figures in the last few days, we've been at around 16.5 lakh, then down to just over 14 and then just over 17. This as tests have dropped in major cities like Mumbai, like Delhi and in other parts. In Uttar Pradesh, questions being raised about tests, Bihar, where people just can't get tests done. So are these numbers accurate? Also, let's just look at the various states where the numbers are showing up. Now, the worst hit states remains Maharashtra. We can see that Maharashtra has 48,700 cases out of 2.2 lakh cases. Now, that's actually going down. On the 25th of April, there were 66,000 cases. Uttar Pradesh now at number 2 with over 33,000 cases. Remember here, testing again a major concern. So actual numbers could be higher. In Karnataka, 29,744 cases. Again, tests here going down. In Kerala, 21,890 cases. Tests again going down. And in Delhi, 20,201 cases. That's slightly down from earlier. And in Rajasthan, 16,438. Let's look at the states worst hit by deaths. The worst hit states are Maharashtra with over 520 deaths. In fact, that's a concern as cases going down, deaths are going up. Delhi, 380 deaths, a record for Delhi. Uttar Pradesh, 249, but those numbers again unlikely to be accurate. Chhattisgarh, also over 220. Karnataka, 201 deaths. Gujarat, 158 deaths. Those are the states which are actually the worst in India. And let's just look at India versus the world. What are India's cases? Now, we're actually about added up to on the lowest, the countries behind us, we are way more than that. India is at 3,23,000 cases. The United States, which is second, is way behind that at just over 47,000 cases, followed by Turkey at over 37,000 cases. Then Brazil, those cases have gone down over 28,000. And Russia at 8,681. So even in daily deaths, India topping that tally at 2,771, followed by Brazil at 1,139. Then the US at 466, France 398. Now remember, France's population minuscule, so that's a high number of deaths there, and Turkey 353. But as we were talking about India's deaths and the underreporting of actual figures. Let's just look at Uttar Pradesh, India's most populous state. Now, in Kanpur, for instance, there were 2,040 new cases and 28 deaths in 24 hours. And these are in amongst also in 17,410 active cases in Kanpur rural. There was only one death reported in 24 hours. There have been 50 deaths so far here. But let's just look at this ground report from Kanpur, where our reporters have actually checked with various cremation grounds, and the numbers they have tell a staggeringly different story.
Through the night, the pyres burn, the flames piercing the dark sky. In this Kanpur crematorium, as COVID takes its deathly toll, a never-ending day and an endless nightmare for relatives.
अब रात है, कम से कम 40 बॉडी आती थी। आपका नंबर? मेरा नंबर 23 है, जो कि अभी तक नहीं आया। अवस्था यहाँ व्यवस्था सही नहीं है। जो चाह रहा अपनी बॉडी पैसे दे करके आगे करवा लेगा। उनका नंबर है, उनका नंबर नहीं आता।
According to the records at Kanpur's Bhairav Ghat and Bhagwat Ghat electric crematoria, last rites were performed on 528 bodies of COVID victims from April 20th till the afternoon of April 26th. The figures do not include those who were cremated in the traditional manner on wooden pyres.
की बॉडी है आपकी कल शाम की क्या वो नंबर नहीं दिया अभी नंबर नहीं दिया अब लेके गए हैं शमशान घाट को जब कहने सुनने पे वहाँ 8 बजे बुलाया था तो 10 बजे बॉडी आई थी.
There are 35 Muslim graveyards in Kanpur. There are a dozen burial grounds in Chunniganj itself. Lavaris Mayyat Intizamiya Society, an organization which deals with unclaimed bodies, says deaths have increased in the last few days.
10 निकल रही है 12 निकल रही जब इस रोड से 10-12 मिट्टियाँ निकल रही हैं तो और भी रोड है जैसे चमनगंज नाला रोड है.
There are 4 cemeteries in Kanpur. Given that Christians constitute 2.03% of the population, the number of deaths would comparatively be lower. But in Kanpur cemetery, the number of dead is on the rise. In the Chunniganj cemetery, 10 to 12 bodies were usually brought in a month. Those numbers are far higher now.
आपको बता दें भी 3 दिन पहले की बात बता दें 14 मिट्टी लाशें डेड बॉडी ग्रेवी यार्ड में पड़ी थी. हमारे पास मजदूर बीमार हो गए कमज़ोर हो गए चोटें लग गई. हमने बाहर से ठेके पे लेबर्स को बुलाकर 1:30 बजे रात तक ये डेड बॉडी गाड़ी है जो कि इतिहास में पहली बार हुआ है.
किसी की कही सुनी बात गलत हो सकती है, कागज़ पे लिखे हुए आंकड़े गलत हो सकते हैं, लेकिन चिताएं गलत नहीं हो सकती हैं. चिताएं तो जल ही रही हैं. एक तकलीफदेह मंजर है. कानपुर में साहिब आलम अरुण अग्रवाल और राजेश गुप्ता के साथ कमाल खान, NDTV इंडिया.
The situation there in Uttar Pradesh. But moving now to what's become a huge battle in India's national capital. After oxygen supply, which has stabilized at least 2 major hospitals today, the big worry is the battle for beds, and the desperation and anger of patients is coming out. Today, a patient's family, a 62-year-old woman who needed an ICU apparently in Apollo, but then died in the emergency. Her family attacked doctors and nurses there. Now, again, doctors and nurses are helpless at this time when they don't have beds, but these clashes there at one of India's top private hospitals, Apollo Hospital. This just reflecting what's now become a larger issue across the city. In fact, the new Sardar Patel COVID Center run by the ITBP, which is said to have 500 beds, actually had a situation where people were dying outside on the road. Sukirti Trivedi reports.
देखा है नहीं पहले फॉर्मेलिटी पूरी करो मैसेज करो व्हाट्सएप करो क्या करे तो देख रही यही बड़े बड़ा चिल्ला रहा पागलों की तरह खड़ा होके देख लो भाई देख लो.
"28-year-old Mukul Vyas brought his 52-year-old COVID-positive mother Kiran in an auto and waited outside the Sardar Patel COVID Care Center for 3 hours. But he could not get a bed for her. She passed away in this auto. There are 500 COVID beds inside the center, but people are struggling to get an admission. Many who even got the DSO or district surveillance officer's reference for admission as per procedure also had to wait for 4 to 5 hours outside.
सुबह 10 बजे से खड़ा हूँ. हमारे बॉस ने उनके जो मेड हैं 2 का रजिस्ट्रेशन हो चुका है, लेकिन यहाँ से बोला जाता है कि अंदर से लिस्ट आएगी, अनाउंसमेंट करेंगे जब आपको अंदर जाने दिया जाएगा. लेकिन 10 बजे से अभी तक ये टाइम आ गया, कोई रिस्पॉन्स नहीं आया. ना हम पानी पी पा रहे हैं, ना कहीं खाना खा रहे हैं.
There are no ICU or ventilator beds right now in the center, and people with oxygen levels below 85 are not allowed, leaving those like 40-year-old Surinder Sachwan waiting on the footpath.
सेंटर बना सरदार वल्लभ भाई पटेल, इसमें भी ये कह रहे हैं ना आईसीयू है, ना वेंटिलेटर है, ना कोई बेड है, कोई इंतजाम नहीं है. आप ले जाओ अपने पेशेंट को. मैडम 15-20 हॉस्पिटल हो गए हैं. कल से हम लोग ऐसी, ये सब ऐसी है मैडम. उन्होंने मुझे रिप्लाई भी दे दिया आप कहीं और ले जाओ, हमारे पास बेड नहीं. हाँ जी, हाँ जी. उनके बाद मेरे पास मेल है रिटर्न का, रिटर्न में आया था, तो रिटर्न में लिख के दिया उन्होंने कि हमारे पास बेड नहीं है, आप कहीं और ले जाओ.
Delhi Chief Minister Arvind Kejriwal today assured that more ICU beds are being set up across Delhi.
GTB हॉस्पिटल के सामने एक रामलीला मैदान है, वहाँ पे हम 500 ICU बेड्स तैयार कर रहे हैं. LNJP अस्पताल के सामने अपना जो मेन रामलीला मैदान है, वहाँ भी हम 500 ICU बेड्स तैयार कर रहे हैं. और राधा स्वामी सत्संग में हम 200 ICU बेड्स तैयार कर रहे हैं. तो ये 1200 ICU बेड्स गंभीर मरीजों की देखभाल के लिए, ये 1200 ICU बेड्स 10 मई तक बन के तैयार हो जाएंगे.
Authorities continue to assure that there will be more hospital beds and facilities in the upcoming days, but here on ground, families of patients are fighting a battle every day, and some lose their dear ones while waiting out on the roads. In New Delhi with camera person Pujaria, this is Sukirti Dwivedi for NDTV.
Meanwhile, the Supreme Court said that the oxygen shortage is a national crisis and said that there cannot be silent spectators while this is happening. The Supreme Court also said we're not preventing the High Court from actually hearing the case, and the object is not to take over what the High Court is monitoring. High Courts are in better position to monitor, but we can't be silent spectator at this time, and we intend to play a complementary role. This is the centre also told the Supreme Court in a 200-page affidavit that the Prime Minister and the Home Minister are personally monitoring the oxygen situation in the country. Meanwhile, as we look at the crisis of beds, of oxygen, of medicines, not just in Delhi but across the country, work is going on full swing for India's ambitious new Central Vista and New Parliament project, which is estimated to cost 20,000 crore rupees. In fact, building of this has actually been made an essential service. So construction is continuing even while Delhi is under lockdown. Apparently, it's been permitted because workers have been given on-site accommodation. But when NDTV did a spot check at the location, we found many of the workers are actually coming from other areas and going back. So in that sense, it shouldn't be happening during a lockdown. And why is this an essential service? Also, the opposition asks, why not spend this money on beds, oxygen and medicines?
Mandal from West Bengal seen here taking a short lunch break to help build India's new parliament building. Across the pandemic hit Delhi, under the lockdown, there is an eerie silence, except here in the seat of power, where the government has granted permission for work to continue on the Modi government's prestige project to remake the iconic Central Vista. The government claims the exemption is because these projects have on-site accommodation for workers. But we found workers who are ferried in from elsewhere.
কি কাজ করছে?
पार्लियामेंट में मिस्त्री करते हैं।
अच्छा, और कहाँ पे रहता है आप?
रहता हूँ कितनी नगर।
अच्छा, और काम करता है यहाँ पे?
हाँ।
ओके, और क्या काम करता है?
और थोड़ा थोड़ी ईंटा जोड़ाई कर।
आप बंगाल में कहाँ पे है?
बंगाल मालदा जिला।
अच्छा, और आप भी क्या काम करता है?
इसी के साथ में है सर।
अच्छा, तो सेम काम करता है। और कहाँ के रहने वाले हैं आप? यहाँ पे दिल्ली में कहाँ पे रहता है?
दिल्ली में कीर्ति नगर।
कौन टाटाज ने ही किया गया आपको जगह?
The decision to go ahead with this 20,000 crore Central Vista project at a time when India and New Delhi are in the midst of a health emergency has sparked anger amongst the opposition parties who are criticizing the move.
पार्लियामेंट में कोई गड़बड़ी तो है नहीं,
इसलिए बनता, लेकिन लोगों के जान के कॉस्ट पे नहीं उस तरह के प्रोजेक्ट में पैसा लगना चाहिए। अभी तो हेल्थ केयर में ज़्यादा से ज़्यादा पैसा लगा के देशवासियों का जान बचाने में सरकार की प्राथमिकता होनी चाहिए।
पता नहीं क्या सोच है और क्या समझ है, कौन से आसमान पे रह रहे हैं ये लोग। सिर्फ इसमें सीमेंट गाढ़ा और छड़ नहीं पड़ेगा, इंसानी खून शामिल होगा। वैसी इमारत का हम क्या करेंगे? दुनिया में कोई ऐसा मुल्क नहीं होगा जो आज के दौर में इतना अनैतिक और अरुचिकर काम कर रहा हो। प्राथमिकताएं क्या है सरकार की?
But engineers, workers and contractors we spoke to say the work will go on despite a migration of workers after Delhi imposed a curfew. They do concede though that it's not possible to adhere to social distancing norms. To push ahead with a vanity project at a time when the capital is reeling under a pandemic speaks to the government's confidence that it can ride out the backlash. Whether that confidence is merited remains to be seen. With camera person Sanjay Kaushik, Sunil Prabhu, NDTV.
So no hospital beds, but the central vista going full swing. Meanwhile, after that call between Prime Minister Modi and President Joe Biden, Vishnu has exclusive details of the massive US assistance package which is being planned. Vishnu.
Well, it is absolutely huge. The United States, along with several other countries, even small countries, Sonia, like Bhutan, which is now coming in with oxygen to India. But as far as America is concerned, a whole lot of steps. Firstly, they have found a way to get AstraZeneca vaccines, which is known as Covishield in India, across in a little while from now. There will be raw materials which are required for the Serum Institute. That will be provided. Most significantly, they'll be looking at setting up oxygen generation plants very soon onto the ground. And there will also be special teams of American healthcare workers who will be deployed to ensure that things work out super fast as far as India is concerned. Now, in as much as we talk about America and we talk about Germany, France, the UK and some other countries, here is something that's really important, and perhaps we need to reflect on it as well. There have been several companies which have actually done a great deal. Google, 135 crores in funding to give India. Gilead offering 100,000 vials of remdesivir free of cost. Procter & Gamble will contribute towards vaccination over 5 lakh Indian citizens. Microsoft will use its efforts and technology to aid relief efforts. Apple about to announce what they're going to get into. Amazon joining hands with a whole lot of organizations to provide, and look at the numbers, 8,000 oxygen concentrators, 5,000 BiPAP machines, Deloitte as well. So the amount of aid that we are actually getting from private companies is very substantial. Absolutely. In as much as we are getting this from countries like the United States.
Thanks, Vishnu. So it's amazing to see that global aid coming in, both government and corporate. And also French President Emmanuel Macron is, a Facebook post in Hindi where he's talked about the fact that no one is untouched by the epidemic we're going through. France knows that India is going through a difficult period, and we've always been united and we're ready to provide our assistance. Meanwhile, moving on to other news, well, fresh highs being reported by various states, Kerala and also Karnataka. That lockdown begins in just a short while from now. Maya Sharma is out in Bangalore tonight. Maya, all getting ready for the lockdown there for 2 weeks?
Absolutely. In just over half an hour from now, the city of Bengaluru, the state of Karnataka, will shut down for 14 days. This is because of the huge spike in cases. Bengaluru alone having over 2 lakh active cases. Essential shops will be open. Shops like this medical shop will be open. Otherwise, essential shops will be open from 6 a.m. to 10 a.m. This flower seller, of course, not deemed essential. She will have to somehow manage to earn her living because non-essential shops will not be open during this 2 weeks. Travel in the state, between the state and other states, not permitted unless it's an emergency. Agricultural, manufacturing and industrial activity will be allowed, but not garment manufacturing. They want vaccination to continue. They want testing to continue. So the police say they will make arrangements to make sure that people have no problems getting there. But public transport will be off the road. So no autos or taxis unless there is an emergency. So Karnataka, Bengaluru, all set to shut down at 9 p.m. a short while from now.
No, hopefully that will break the chain. But of course, that ban on interstate travel in a sense is controversial because many other states haven't done that. So let's see how that actually works out for people on the ground. But that's going to lock down, as you said, at 9 o'clock. Thanks, Maya. And moving across to Kerala, where, as we said, now again, cases are record high in the state, over 30,000. But Kerala, unlike many other states, is already getting ready. Their war rooms, their extra beds are already in place. Many other states of India should take a leaf out of the Kerala model in this aspect.
COVID war rooms like these in every district of Kerala are buzzing. From finding a hospital bed for a COVID patient to contact tracing, the updates are real time, every 4 hours.
Currently, I will be calling medical officers on every CFLTC and CSLTC, and from them I will be getting the current update about how many beds are available. I will be sharing this with our other team members, so that they can, within 5 minutes, we can shift a patient from their home to CFLTC or CSLTC.
Kerala already has the maximum healthcare personnel to population ratio in the country, but they have commissioned additional forces.
We have recently deployed 2,000 teachers. So for each corporation ward we have 5 teachers, municipal ward we have 2 teachers. They will help the rapid response team in the field level to identify the patients, isolate them.
There is an effort to rationalize and streamline use of resources at a time of high demand.
With the test positivity rate crossing 22% in Kerala, the triaging system of demarcating COVID patients into A, B, C category is turning to be the backbone of the system to manage resources, and it starts right at the primary health center.
In districts like Thiruvananthapuram, Ernakulam, where bed occupancy has crossed 70% in the government sector, the focus is now on getting critical care beds added on a war footing.
Last time when we had the surge, we had prepared somewhere around 3,000 critical beds, and this time we are focusing on double of that, 5,000 to 6,000. And more importantly is this time the one new change that we are doing is that all critical beds we are trying to ensure oxygen beds.
Private hospitals have been asked to reserve 25% of their beds for COVID patients and put off non-urgent surgeries.
There are frantic calls for beds, that is one. Till 2 days ago we have to say no to many patients. And yesterday we were able to open up another ward to occupy or increase the bed strength, especially oxygen beds. So we were able to receive.
The strict restrictions across Kerala from today, an urgent measure, says administration, to keep the COVID-affected numbers below the surge capacity. With camera person SP Babu, Sneha Koshi for NDTV.
And as states battle a COVID surge, the big challenge is also to keep the vaccination rate going. So let's just look at our vaccinations. Now, we had a big high on the 25th of April, that's Sunday, of 64.3 lakh people vaccinated. But just look at yesterday's figures, where there's always been a 50% drop, where vaccinations were just over 33.5 lakhs. Our total vaccination now is 14.5 crore, but we really need to scale up this rate immensely. Now, Maharashtra is a state which has vaccinated the most in the country, but it's already seeing huge lines at vaccination centers before the first May deadline to open up vaccines to all Indians above 18. And Maharashtra still hasn't actually decided how it's going to get its stock to have all those vaccines ready. They've written to manufacturers, but it's still a big challenge.
A crowd at the vaccine centres in Mumbai on Tuesday as people queue up to get vaccinated, even in the scorching sun. While these are scenes today, the load is expected to increase when people above the age of 18 start receiving the vaccine from 1st May.
करीबन 2 घंटा हो गया है लाइन में, क्योंकि अभी 1 तारीख को ज़्यादा भीड़ होने वाला है, क्योंकि 18 साल की उम्र के लड़के लोग भी आने वाले हैं, तो और भी भीड़ हो जाएगा, वैक्सीन खत्म हो जाएगा.
As of Tuesday, 1.5 crore people have been vaccinated in Maharashtra, the highest in the country. On Monday, 69,577 people received their vaccine doses in Mumbai. But now, the big challenge will be to vaccinate all those above 18 years of age from the 1st of May, for which authorities are meeting to chalk out modalities.
18 के बाद जो 60 प्लस है या 45 प्लस है, उनको लग रहा होगा कि भीड़ ज़्यादा होगी और हम इससे पहला कर दे, वो भी एक कारण हो सकता है.
Maharashtra has more than 50 million people between the age of 18 and 44, and the government needs about 120 million vaccine doses to vaccinate them. The state government has written to manufacturers of Covishield and Covaxin to inquire about stocks. The state governments have not been allowed to hold talks with other vaccine manufacturers who were recently given approval. Maharashtra's Health Minister Rajesh Tope has also raised questions about the availability of vaccines.
1 मेला आता जर वॅक्सिन्स उपलब्धच नसतील तर मग कसं द्यायचं हा प्रश्न सगळ्या राज्यांपुढे येणार आणि त्यामुळे ज्याचा आता कोविशिल्ड आम्हाला सांगितलं टाकलेलं की 20 मेच्या नंतरच बोलावं, कारण त्यांचं जेवढे काही उत्पादन क्षमता आहे त्याची ते सगळे तिकडे देत आहेत किंवा ते आम्हाला देऊ शकणार नाहीत. आज असं तरी आपल्याला त्या ठिकाणी सांगण्यात आलेलं आहे.
It would be very important to see that what will be the latest figure, how many people are being vaccinated not only in Mumbai but in Maharashtra today, and those figures will be very important to see based on the number of people that we see that are turning up at these vaccination centers. In Mumbai with camera person Rajendra Dayalkar, Sohit Mishra, NDTV.
Well, a day after a Madras High Court rap, the Election Commission of India said it's banning all victory rallies on the day of counting, and even after that's the 2nd of May this Sunday. Also, a statement was issued by the Election Commission after the Madras High Court's strong statements, saying that the statements attributed by the media don't find mention in the court's final order. We'll follow court orders. They're meant to give a plan for counting and inform the High Court on steps taken for free, fair and safe elections, but adding that it's the responsibility of states to enforce COVID measures. Despite Election Commission directing authorities to do so, we are not the state disaster management. Meanwhile, the Kumbh's final Shahi Snan happened today. Now, it is much, much smaller after new protocols came into place amid the COVID surge. But just look at these pictures. There's still way too many people here. This is the last Shahi Snan. It's a quarter of what would normally have been here, but still too many people here on the last day of the Shahi Snan. And well, people do many crazy things during COVID, but during the auspicious marriage season, this couple decided to get married at all costs. So the Shadi in PPE suits because the groom is corona positive. Why couldn't they have waited till he had recovered? Well, perhaps it's because with auspicious dates, you don't know when the next one will be coming again anytime soon. So there you can see the Shadi with everyone in PPE suits.